It's always a pleasure to see conferences like HEAL have a life of their own. And the reason why I say that is not very often do you find organizations and conferences which actually propagate good management principles and good management activities in healthcare having a life of their own. Most often than not, you see one-off conference happening and then it just dies its own death. But it is so phenomenal to see HEAL continuing to take its place and continuing to be done year after year, and obviously creating better and more efficient managers. Healthcare, as we all know, is still rooted in 19th century management principles. At a time when we are in the 21st century, the way that we often deal with healthcare, and particularly healthcare in today's times, it still goes back many, many decades. And the reason being because we have never proactively gone after creating good management principles around healthcare delivery for a very long time. And it is up to institutions like BMH over here to sort of create that guiding light around why good management principles make great healthcare organizations. And you can see it as the organization itself has evolved over a period of time. So let me, for a minute, take you through a couple of areas which I believe are important in today's context. 1 out of 6 people around the world is an Indian in this planet, right? Last 25 years, India has almost close to 250 million people. We are averagely adding about 8 to 10 million human beings on the planet and on Mother Earth every year. Effectively, that means that we have to get ready to provide healthcare services to N number of people every additional year. On the other side, which is so true for India because we work in diametrically opposite situations at most times, we have 1.3 beds per 1,000 people, which is the lowest in the world. I see a lot of healthcare around the world, and it is not so often that you come across a 1.3 billion people country having the lowest density of beds per people anywhere else in the world. So a lot more needs to get done. Thirdly, if you take a look at it, we actually have 16% of the world's population. We have 20% of the world's disease. How does this match up? Right? And that's what I said, that diametrically opposite situations. So which effectively means that as we evolve more and more, and as we keep on adding more of our own population, we are also adding to the global burden of disease. And therefore, the effective utilization and effective strategy to deal with healthcare is never more important than in any other part of the world than what it is in India today. We have a lot to do in front of us. The starting of universal healthcare, Ayushman Bharat, a lot of these other initiatives that are going on, countries around the world have done it for many, many years. Thailand did universal healthcare coverage way back in 2002. China started its reform in healthcare in 2008, and in 2019, they would have probably completed their universal healthcare coverage. Indonesia is currently implementing it and is about to implement it. So, universal healthcare coverage and trying to basically provide healthcare to its citizens and to its population is nothing new to the world. It is something that should have been done many, many years back. But we still continue to spend about 1.5% to 2% of our GDP on healthcare, and so therefore a lot more to do. So let's just take a quick look at what are some of the fundamental shifts that are happening around healthcare in the country, right? And some of it could be a lot more corporate, some of it could actually relate both to corporate and to the not-for-profit world. Some of it could also consolidate itself in terms of the way that we need to create a path for effective healthcare administration as we move along. So number one, consolidation. I'm sure that as students of healthcare, which many of you look like, you would have seen and heard about the rapid state of consolidation that's happening in this sector. And the reason being why? The reason being that as we look around the world and as India goes through its own maturity cycle of healthcare delivery, we find that the larger enterprises and more enterprises want to go deeper and deeper in the geographies around the country. Rightfully so, because it is very important that you begin to consolidate and create more effective healthcare delivery ecosystems in the geographies where you belong. Not just so, but even in the geographies which you are not there today, everybody is aspiring to actually become more and more relevant, not only in their own geographies, but in their own regions, and then therefore at a national level. So consolidation is going to be the mantra that we will see happen more and more in the Indian healthcare ecosystem. And we will see that happening also because, as Dr. Alex very rightly said, that we're seeing a lot of price pressure. For the first time in this country, we're seeing so much of regulatory pressure coming on through multiple doors that it's actually becoming difficult that until and unless you create scale and therefore the cost gets sort of fragmented through a larger scale, that's how you become far more effective from a sustainability perspective. So, and your own hospital is a classic example where you've gone from 200 beds to 400 beds to 600 beds. Scale brings about its own opportunity. So consolidation. And when consolidation happens, that effectively also means that we need to run far more efficient healthcare ecosystems. And that effectively means that all of us together have to imbibe a lot of management and leadership principles, probably from some of the other industries which have sort of done better for a long period of time, and imbibe those principles in healthcare, and therefore trying to serve our consumers better than what we've ever done in the past. Changes in the regulatory domain, which are here to stay and will probably change and alter the landscape of this sector forever. And it's not just about the price controls that have happened around consumables, around services, around medication, the entire DPCO order, and then suddenly a lot of that shifting onto the healthcare delivery side. The reason why we need to become far more productive and efficient is because we are living in an era where payer mix is changing and altering itself at an all-time high. I remember when I started my journey in healthcare, which was way back in 1991, the payer mix at that given point in time, self-pay versus third-party payment mechanism, used to be 90s to 10. Today, it's reversed. And therefore, in a reverse kind of a situation where third-party payment mechanisms are going to actually become your more domain of patients walking through your corridors, that effectively means that it will change and alter the entire cash flow mechanisms that you have inside the institutions. What does that frankly mean? That actually means that we need to run our operations far more effectively. That effectively means that we need to delayer our organizations. That means that we need to do a lot more in terms of the way that we utilize our capex. And therefore, this terminology called return on invested capital, which is not very often that people in healthcare heard, is suddenly staring us more and more in the eye. So one of the things which is becoming more and more important is we want all the technology of the world, we want the best infrastructure in the world, we want the right clinical activity to happen in our environments, which all costs tremendous amount of capital. But return on that capital is going to get more and more minimized if price control takes place. So therefore, we have to invest right. We have to make sure that we actually effectively use our infrastructure to the best possible opportunity. Another word, which I'm sure you're hearing of more and more, there's a terminology called EBITDA, right? Frankly, 25 years back, nobody used to talk about EBITDA. Right? I'm sure 10 years back, nobody spoke about EBITDA over here. But can people raise their hands and tell me that they know about this word called EBITDA? How many of you actually know the terminology EBITDA? Why is everybody talking about this terminology? And suddenly, why is the industry woken up to this terminology called earnings before interest, tax, depreciation, and accruals? The reason being that that's the operating matrix of health of an organization. It's the operating metrics of health for a company, of an enterprise, of your hospital. And for many years, we never really thought about it because it was not of a big concern. And because every year we were able to take whatever little price increase we needed to take, our cost of people was not increasing at such a phenomenal pace, we would still be sustainable and viable, and we could make sure that whatever extra comes in, we pool it back into our institutions for its growth and for its capex. That one word is today becoming so critical, particularly because we're living in the world of capped pricing. And therefore, it is so important for us to actually demonstrate healthy margins on the back of better productivity. And it's again, while it is in a commercial world, but I think what it is important is that our patients don't really know about all this. Our patients don't know that we buy 95% of our consumables, which are all pegged to the US dollar. Our patients don't know that the rupee depreciates 25-28% every 2 years. Our patients don't know that today the dollar is pegged at 70 rupees, whereas 8 months back it was at 65. So for all of us who do imports and who buy all this imported technology and equipment and consumables, we end up paying a much higher value for everything that we are basically purchasing today as enterprises. Why is therefore EBITDA important? Is because for us to continue to be sustainable, each one of us sitting over here needs to understand this metric, needs to understand the relevance of this metric, particularly in the changed environment of healthcare that we live in. Evolving customer preferences. Never before has social media ruled our lives so much. In all our years of living, we never really had Facebook and WhatsApp and whatnot, right? Instagram, and everybody clamors around likes and dislikes. So our lives are almost getting governed by likes and dislikes on Facebook. Guess what? We were not meant to be on Facebook, right? Our healthcare services were not meant to be on social media. Our healthcare services were rooted in good infrastructure, good technology, great doctors, and therefore great clinical outcomes. We did not ever have to face a situation where somebody would go on social media and say, I was not served great tea this morning at this hospital, and so therefore the quality of care here sucks. Not at all, right? We live in this world which has changed so much, and therefore the added burden that we face today, and rightly so, is the massive consumer pressure that's coming and hitting at us along with everything else. Consumer preferences are being guided by experiences. Consumer preferences are being guided not on the back of great quality of infrastructure and people and technology and great clinical acumen, but it is being guided by the fact whether my neighbor had a great experience there or no, whether my father and mother were treated well, whether my brother went through a great surgery. Suddenly we find ourselves in the world where we have to do a lot more as healthcare providers to show that we are effective organizations, to show that we are leaders in what we do, not because we have the latest 3 Tesla MRI, but because we also treat our customers in the best possible way that we ever can. That is Judgment Day. That truly is the way forward, because we cannot get influenced and negatively influenced by factors which are beyond us, and so therefore that added thrust on our corridors today to create a healthcare delivery ecosystem which is outstanding in the way that it connects and relates to its customers. We have a lot to think about, because in this great world of social media, we suddenly find ourselves in a situation which we had never ever envisaged earlier. So something for us to again think through. We talked about the payer mix, and we talked about how it is going to evolve further. I was actually surprised the other day, one of my portfolio companies, which is in the mother and child care work, the CEO comes to me and says, we have just opened this new hospital in Delhi, and the local GIPSA is actually talking about 25,000 rupees for a birthing. And I said, what? So he said, yeah, the insurance company is actually saying that the maximum that we can reimburse you is 25,000 rupees for a delivery. The cost of doing that procedure is almost about 35,000 rupees to 40,000 rupees in our today's healthcare environment, right? With our clinician cost, with the cost of our infrastructure, safe environment, outstanding care. So we are dealing with disruptive thought processes around third-party payment mechanisms, which effectively means that we are going to constantly be combative from the perspective of trying to prove to third-party payers that why we are much better served and why we should be commanding better pricing from third-party payers because our results are better, because we are far more effective, because our patients love us a lot more, because the amount of technology that we have actually invested behind delivers outstanding clinical care, because we are a better healthcare delivery organization. Those are things which are now becoming more and more of the conversation. And therefore, even as Dr. Gyani and the team started the entire accreditation process, layering organizations A, B, C, D, and therefore on the back of that, the reimbursement systems. So life is getting complicated for all of us. It is also becoming very challenging for all of us. Because, again, as I said, we were never wired to be thinking like this. We were always wired to think one way. But suddenly, we need to rewire ourselves, reimagine the way that we think about healthcare delivery, and reimagine the way that we are actually conducting ourselves. Our rising input costs and everything else that goes with it. So more than ever before, the concept of moving from sick care to actual health care is becoming so relevant in our lives. So important is this connection between primary care and hospital care, and connecting the dots over here to see as to how we can create a more effective ecosystem. So important it has become to make sure that patients and consumers, healthcare consumers, actually don't need to come to hospitals. So important it is becoming to make sure that our environments, our hospitals, are actually catering a lot more of acute care. So building the blocks of primary care in the community, trying to make sure that in some form or the other, we are connected inside the community with our healthcare, primary healthcare offerings, even as organized players like ourselves over here at Baby Memorial or others, is so critical. We have to bring back and we have to bring the focus into primary healthcare more than ever before, because these are the dots that lead us to actually keeping our communities healthier. These are the dots which actually take us into the environment and into our families and into the families of our patients and their near and dear ones to create effective healthcare, to actually create the opportunity of not becoming just a sick care country, but a country which offers equally good health care. There is a distinction between the two. If I had the time, I would actually tell you in data, but there is a massive distinction between the two. So let's just, for a minute, go back into the World Health Organization recently put out a report that for every $1 worldwide, for every $1 that is invested behind making the community aware of the dietary changes that will keep them healthier, actually returns $13 to the community and to the enterprises that actually invest that $1. For every $1 that is invested behind trying to make the community aware about the impact of alcohol consumption and therefore NCDs and therefore everything else that actually it translates into, actually returns $9. For every $1 that the world spends on reducing tobacco consumption, it returns back $7. Now tell me, with this data, can we go wrong if we go back into the community and start talking about prevention? Can we go wrong by moving into the community and actually talking about health care rather than sick care, which is nothing but acute care? We need to do a lot more around this. And this is really the foundation of primary health care. That we need to talk a lot in this country around NCD protection. We need to do a lot more around anti-diabetes and anti-hypertension and everything else that goes along with it, because that truly will be transformative for this country. And that's when our infrastructure, our environment, and everything that we actually provide, which is all about saving people's lives, we will do a much better job around it. So these are some things that we need to start thinking about. It requires a totally new generation of healthcare leaders. It requires a totally new managerial acumen. It requires a constant wave of new thinking. It requires a lot more of unfolding ourselves and opening our doors to what many other industries have done right, whether it is from consumer connect, productivity enhancement, efficiency. There are tons and tons of industries around us which have actually done a much better job of creating efficiency in their own enterprises and in the way that those sectors run. We have in healthcare a lot to learn. And I hope that HEAL opens up its doors once again for you over the next 2 days in making some of these learnings happen. Thank you very much. It's a pleasure to be here.